Beginning with this year's elections, voting gets a whole lot easier.
Your mailbox is your ballot box.
Your ballot packet comes to you in the mail.
But only if you're a registered voter. If you need to register or update your address, do it today at elections.hawaii.gov.
Look for your free Hawaii Elections Guide in the newspaper or at these locations statewide.
The deadline to register for the general election is October 5th, so don't delay.
Hawaii votes by mail.
Well, aloha and happy Aloha Friday. I'm Ryan Kalei-Suji, joined by Yanji Denise. This is Spotlight Hawaii here on the platforms of the Star-Advertiser. And today we are actually doing a special edition. Normally throughout the month, we've been joining you every Monday and Wednesday. We've added this Friday date, and moving forward, we will actually be joining you Monday, Wednesday, and Friday. We are going to be joined this morning by Honolulu Mayor Kirk Caldwell, who will be joining us in just a few moments, of course, to talk more about some of the testing that's happening here and all the developments that are happening with COVID-19 related to what's happening here on the island of Oahu.
That's right. The stay-at-home order went into effect for 2 weeks, started yesterday. We know a lot of you still have some questions about what may or may not be allowed. So we're going to be hearing from him on that. There's also some big plans in the works for some mass testing. We're looking at possibly Aloha Stadium shutting down H3 to allow for that. So we'll be talking to him about those plans. And also there's that website that they've launched, the doineedacovidtest.com, where you can pre-register if you want to go to a testing site, so you perhaps don't have to wait as long. So right now we are joined by Honolulu Mayor Kirk Caldwell. Thank you so much for being here, Mr. Mayor. We know that you are incredibly busy, but tell us so far, one day in, how is the stay-at-home order working?
Yonji, it's good to be before you. And Ryan, it's been some time, and I apologize. This has been so busy for many, many months. And I apologize for being late. I was just on the phone calling furniture stores that are still open. And it's kind of fun to do, because I called them and asked me, "You open?" They go, "Yeah, we're open." And I go, "Why are you open?" And they say, "Oh, because we're open." And I go, "Well, you're not an essential business." And they respond with, "No, our lawyer said we're essential. We sell mattresses, and people need mattresses to sleep on." And I said, "Well, I'm the mayor of the city and county of Honolulu. You're not supposed to be open." And then they get very quiet. Another one, they answered saying we're open. And when I went through that same thing, they said, "Well, I'm not sure whether we're open or not." I said, "Well, you just said you're open. Are you open? You're not open." But here's the point, and I lead with this. You know, many reputable businesses are following the stay-at-home, work-at-home order if they're non-essential. Companies like CSWO, Inspiration have closed their doors to the public to help control the spread of this virus. And then we do have irresponsible businesses. Many of them, the ones I called, are not local businesses. They have branches here, but they're run by corporations outside of the state of Hawaii, and they don't seem to care. And that's where I think we're going to have trouble in this lockdown. If people do not take this seriously and comply with the stay-at-home, work-at-home order, it means that this order could stay in place longer, and it could mean we could see more deaths. We saw 3 today, and still a high number of cases, over 200 on Oahu. And so it's incumbent on everyone. And I'm going to make it a personal goal of mine to call businesses when I hear they're open, to talk to them. And if they don't shut down, police officers will show up at their doors, warn them. And if they refuse to shut down, they'll be cited, and they can go to court and explain to the judge why they refuse to keep the people of Hawaii safe. They're customers, by the way.
You know, we want to kind of stay on that theme of this order and this just the overall enforcement, because we're seeing comments and we're hearing from people who are saying they know friends that are still gathering at their other friends' locations. They have family members that are still having sort of these potlucks that have happened in the past few days with this current order, which we know is, in violation of the order. What would you say to those people that are reporting this? Should they be calling that hotline that is established? And how enforceable is that with having people over at their homes?
Well, they should be calling the hotline. That's why it's there. And the police department is following up. So you're right, Ryan. I'm seeing social media posts. There's supposedly a big party on the North Shore this weekend with the DJ. I've heard of other gatherings here on the South Shore in people's homes. And right now that is illegal and prohibited. And the police, when they get complaints, if they can, through investigation, see that the order is being violated, they will go in and cite. And they can cite the homeowner, or in the case of a party on the North Shore, cite everyone at this party if it's outdoors. And we want to know where this is occurring. And the bottom line is this. I mean, there has been so much pain and suffering, and we're on war footing right now. We're fighting a war. We all need to do our part, and the vast majority of people are. I know you guys are. All of your friends are. But there are people out there that don't take this seriously. People are dying. We had 4 people die yesterday. We had 3 more die today. But the thing I learned when I visited Queens last week, Friday of last week, I went by to see their ER unit, their COVID ward unit, to see how they're doing, and talk to the frontline nurses and physicians and other care personnel. It's unbelievable the work that they're doing. But the one thing that I did not understand clearly is this issue of morbidity. And morbidity is the long-term impacts when you recover from COVID-19. And they're saying they're seeing more and more patients from early on in March and April that have lingering side effects, an inability to breathe well. They can't run. They can't walk upstairs. They get out of breath. They have what's called brain fog, like if you don't have a good night's sleep and you wake up kind of fuzzy-headed, that people are having strokes and blood clots, that there's clots in your lungs and legs. And they think some of these could be permanent, long-lasting effects. And so they pled with me as mayor, saying, you need to really do another stay-at-home, work-at-home order. It's not just about saving lives. It's about protecting your population who could have long-term, and if not permanent effects, even if they recover, and even if you're young. And this is the point. They said they're seeing more and more young people coming in than in March and April. It's really changed. About half of the people were younger folks, where before it was mainly all older folks. Half are still old. The other half at Queens are younger folks. And they've also seen more Filipino Americans coming in on this cycle than the first cycle. It was more Pacific Islanders. It's still a lot of Pacific Islanders, but Filipino Americans. So I'm asking those guys who are going to a party or having a potluck at your house this weekend with a lot of people, you could get your friends, loved ones, and family sick, and maybe they're young and they'll recover, but they may never be the same again, ever again. So please don't do it. For 2 weeks, we can sacrifice. We can win this war, but we all got to sacrifice.
Well, and you alluded to at the top that we might have to go longer than 2 weeks. At what point do we know that that what we're doing is actually working? Because we do know that a number of these tests, especially with the surgeon testing that you're doing now, do have to go to the mainland and then come back. So there is a little bit of lag time. So when do we know that it's actually working?
That's a very good question. So 2 points. Every morning now I talk to the healthcare providers at the major hospitals and about the numbers. And so today's number for a while was 216, a little better than in the past, still too high, but better than it was yesterday at 265. And maybe we're seeing some of the impacts, maybe not from this stay-at-home, work-at-home order. It's too early, but about a month ago now, we shut down bars, and about 3 weeks ago, we closed parks and trails and beaches to large uncontrolled gatherings. And then more recently, gathering size of just 5 and don't gather otherwise. And now the stay at home. So I'm hoping we'll see some of the results, but we do know from the surge testing, we tested probably now close to 10,000 people in 2 days. And so we're going to get more positives back, obviously, but it's also the percentage of positives. So the more people you test, you have more positives, but the percentage may come down. Now, up until yesterday, that percentage of positivity is way too high. You heard the Surgeon General say we're in the red zone. We are. And as we get our test results back, because we're testing more people than you test in any given day, and one day we're maybe doubling the amount of tests we would otherwise do in the past 2 days, the percentage of tests goes up. And even though the number goes up, the positivity rate could come down. That's good news. The bad news is we're going to know more positives, and that's a burden on tracing, right? For every positive, we need to contact trace to who else they came into contact with. And right now we're seeing about 250 cases a day. That's 1,000 every 4 days. And it gets really hard to contact trace that kind of level. So we need to see that number come down. The overall number needs to come down too. If the positivity rate comes down, but the number still stays high and we can't control, we're not able to get ahead of tracing, we may have to continue the stay-at-home, work-at-home order a little longer. My hope upon hope is we don't have to do that. We're only on our 2nd day, so I don't want to be talking about extending it. I'm holding my breath and hoping for the best. but we'll continue to talk about it and share information as we go forward.
You know, we talked about the, you mentioned the testing that's happening, a lot of that having to do, of course, with the Surgeon General. We have a question from Grant Kanoho, who's asking, what prompted the visit from the U.S. Surgeon General and how long will he be here? Seems like his presence has been beneficial in terms of speeding up testing. Can you explain how that visit came about and how this sort of surge testing sort of kind of came together?
So it's a very good question, Grant, and we are very lucky the Surgeon General came out. He added a lot of additional oxygen in the room, and I think he helped pull a lot of different groups together and get more focus, which I'm very grateful for. He left yesterday evening, came in on Saturday, and spent more time than was planned. He was going to leave on Wednesday, and he extended by one more day, which we're grateful for. How it came about is about 2 weeks ago, we got a call from the White House, from Dr. Birx. She's the woman you see standing behind the president with the scarves. And sometimes when the president says things that to many seem to be outrageous, she'll kind of hang her head low and cover her hand like that. Excuse me. She actually reached out and called me about 2 weeks ago and said, you know, Mayor, I used to work in Honolulu. I'm familiar with your community and the Pacific Islander community, and we're noticing the number of cases out there. And so we're calling to say, how can we help? And I was so grateful. And so I said, we need more testing capacity. We need assistance with contact tracing, things we've been talking about here at the city since March, as you know, and you've covered it. And finally, remdesivir, you know, this drug that has been very effective in treating COVID-19 patients. I'd heard from our medical panel and from the doctor, you know, the hospital managers that I talked to every day that they needed more of that. And she immediately said, we'll get you more remdesivir. And in fact, 86 cases showed up last week instead of 35. And then she said, we're going to have the Surgeon General talk to you about surge testing, which I'd never heard of. And we had a discussion a couple of days later with the Surgeon General staff about surge testing. And then they said the Surgeon General will be coming out. We're going to bring this to your city. And we're going to test up to 5,000 people every single day for 2 weeks, to 12 to 14 days, hitting about 70,000 cases. And sure enough, they showed up. Now, I think it was partly, you know, we were doing so well nationwide, and then, you know, we ended up having problems, and I think they noticed it, and so they reached out, and because we asked for help, they provided it. We're very grateful for that. You know, we can't win this war unless you have the federal level, the state level, and the city level all working together. And you saw that in spades this past week, and I hope we can continue to do it going forward. But thanks, Grant, for that question.
Christopher McIntyre has a question, and I know that you guys have an infographic which is very helpful, that says basically the list of can and cannot. But this is, can people that live in the same household do approved and essential activities together? I think there are some questions, you know, with the limit of 5, especially let's say you have extended family and maybe you see mom only on the weekends. Does she count as that 5? And how, what is your advice to families that, you know, and to Chris's question?
So thanks, Christopher, right? That's a great question. You know, right now we're saying stay at home, work at home with your own family unit in the family that you live with. If you need to do essential activities like going shopping, if you need to do it together, that's permitted. Although I'm just speaking now as someone who's concerned about the health of folks, you know, I would hope that you don't need to all go out together to go shopping. If one can go and do most of the shopping, that would be better, because you're risking exposure as you go out, even with face coverings. And so perhaps one person goes out and does the shopping at a time. But if you're a senior and you need to assist that senior, I understand. So those kind of activities. But coming from a different household, like for example, my sister who lives in Kailua, I'm not going to go see, even though it's just her and her husband, and my wife and I could drive and see them. It's only 4 of us. We're not going to do that, because that's gathering of 2 different household units. And there's a possibility that one of us could be infected in one of those units and could spread it to the other. So I'm asking for the next 2 weeks, please don't do that. Stay at home, work at home, and protect each other.
You know, going back to sort of the surge testing that's happening, you know, we've seen it play out over the past few days, and it's a scene that we've seen really throughout the country, where we're seeing these large number of people showing up for these mass testings and people having to wait hours to get tested. Who's really managing, I guess, the testing on the ground during this? And has the process maybe been streamlined over the past few days? Or do we continue to expect these long lines just because the demand now is just so high?
So this is being run out of an incident command by the Honolulu Fire Department. And if you went over with me to the headquarters on South Street, you walked in, there's 30 or 40 people there right now working to coordinate all of these sites and to make sure everything rolls out smoothly. And it's not just a matter of coming and being tested, it's getting the test kits to the sites and replenishing them as you go through the day. It's picking up those test kits and getting them to FedEx by 2 in the afternoon so they can be sent to California where the test is done. And if they don't get there by 2, you have to wait until 2 the next day. So there's a lot of coordination and timeliness here to get it done quickly. And so the Honolulu Fire Department has been doing an outstanding job. And then they're working with the Honolulu Police Department to manage traffic, which the Honolulu Police Department is trained to do. And then also General Hara has lent National Guardsmen. And so they're out there also helping at the sites. And then also Fed Fire and State Fire are also there. So it's all hands on deck, federal, state, and city. But the Incident Command Center is at the Honolulu Fire Department. And I think they're doing a great job. Now on traffic, part of it is, the Surgeon General said no city we've gone to, not Miami, bigger than Honolulu, not Houston, the 5th largest city, has ever hit 5,000 tests a day. It's a goal that no one has hit. And we wanted to try and hit it. And on the first day, we hit over 4,800 tests, almost 4,900. We almost hit 5,000. And so what was really good news, and that was with announcement just the day before. The good news is there's a lot of interest. And I think it's because it's free. I think it's because you don't have to have symptoms. It's surveillance testing. You don't have to quarantine while you wait for your result to come back. And so a lot of people came out because they're interested, but it did overwhelm the sites that we selected. I personally want to apologize to those who had to wait a long time, and even more so to those who were either turned away or gave up. My request to those is that please don't give up. Come back with your family unit, your family bubble to be tested at these different sites. And I think we did better yesterday with traffic management. And I think we're going to do better because we're picking now different, better sites. Like Aloha Stadium, on the first day when we saw the problems, I reached out to the governor and he said, fine, if you need Aloha Stadium, it's yours, let's work together. We know through food distribution that's a very good site because a lot of entrances, a lot of exits, a lot of pavement for cars to come into. And then, of course, H3, which you mentioned, Ryan. That's a unique, first ever historic endeavor. And I understand that at least one of the testing sites will be in the tunnel itself. So you can come in, there's a lot of lanes. You can pull over and be tested in your car at multiple places. It's enough pavement. And so this is going to be an interesting rollout to get more testing. And then yesterday at Kalakaua District Park, it was a walk-in testing site. I went down there and it was a pretty smooth process. I actually thought people versus cars was a little more quick, a little more peaceful, not as hectic or chaotic. And we tested about 1,500 people there just through walking in. All kinds of people in an area where we have many Pacific Islanders and many Filipino Americans. So we're going to be looking for more walk-in sites. Palolo housing, we're going to do a walk-in site there, probably in the district park in Palolo. Camp 4 housing is another one. You can maybe use a district park there as a walk-in site. So we're going to do a combination of drive-in, walk-in, H3, never done before. And we're learning as we go forward, and we're asking for the public's patience. And again, I apologize to those who felt very frustrated.
Jan has a question, which I think a lot of us have. Jan Fontaine asks, what do you think caused the surge after a few months of low numbers and minimal tourism? I mean, you look at these numbers and you think, where did we go wrong? A lot of people are pointing at the Department of Health and the lack of adequate contact tracing, which we know now you are standing up. But, how would you answer Jan's question? What went wrong?
So, Jan, thanks for that question. I ask myself that, and because as we shut down again, as we open up, we don't want to have it go wrong again. We want to make sure we learn from our past mistakes. And so I think there's a couple reasons. One, I think as we opened up, perhaps we opened up a little too quickly. Perhaps there's a rush to open everything back up. And perhaps there are certain things that we opened up that maybe we shouldn't have. I know there's a lot of discussion on gyms, for example. We do know that in this county, but also in other cities and countries around the world, there have been super spreader events through gyms and also bars, another super spreader venue that we've seen both here on Oahu, but in cities around the country and around the world. And so the second time as we reopen, being a little bit more cautious and maybe a little slower in terms of how we do it. For example, parks. You know, as we reopen, we want to get people out in the parks to exercise. We know how necessary that is, and I hear from folks every day on this issue. And so as we open up, perhaps we won't go back to where we were before as quickly, where very quickly, within a month or two, you had large gatherings, right? Anyone who went to the beach, and you have young kids, you go to the beach, you'd see 30, 40, 50 people under a tent. I mean, I went to all over the island. I saw hundreds of people at baby luau's sitting in tents, no face coverings, no physical distancing, close together for hours and hours and hours. And the virus spread that way, but it also helped let our guard down. Like, hey, we're back to where it was before. We don't need to worry. And we did need to worry because that virus is out there, sneaky, sleeping there. And as we let our guard down, it starts to spread again. And that is what happened. So all of us need to do our part, but government needs to do better too. Yunji and Ryan and Jan, we need to do better. And that's why on this shutdown and the reset, the city and county of Honolulu is not going to wait for Department of Health to do things. We want to work with them, and it looks like they're doing more, but we're going to do our part working with Department of Health. And so surge testing, you know, we never had control of testing. We tried. We got the Surgeon General to do surge testing, and we're doing more testing with our community health centers. We're going to keep doing that. Contact tracing, we've asked for permission to hire contact tracers. We're still working on an MOU to do that, a memorandum of understanding with Department of Health, because they have the authority. We can't do it unless they give it to us under Hawaii revised statutes. And so we're asking for that authority to hire a minimum of 250 contact tracers, a max of 500. We know we need about 400 to 450 for a population of 1 million like Oahu. If we have extra, I think that's better than not having enough. And then the last part is isolation. So we went out and found a hotel on our own. We worked with the Department of Health to have it managed for COVID positives and also for those who came to close contact. And we're working right now and retaining 2 more hotels. We'd like to see maybe up to 700 hotel rooms ready to go as we do the surge testing. If people need to be isolated, particularly in multi-generational households, we can provide a place for them to be isolated and cared for, given food, given the wraparound services, and protected so they don't infect their other family members.
You know, you mentioned the beaches and parks, and we're getting a lot of comments about them. It's hard to bring in just one because there's so many that are asking about this. And people are wondering, is there a way to potentially just open up the parks and beaches like we did the first round that will just allow for exercising? No, you know, people gathering in tents, maybe not allowing tents, not allowing people to lounge on the beach, but just allowing it as a place where people can exercise. Is that something that could potentially roll out sooner rather than later in some of this, during this 2-week period?
I don't know if it's possible maybe in this 2-week period, but I'm thinking at the end of 2 weeks, perhaps there's a way to open up our parks to solitary exercise. Now, people say, what's that mean? Is it one person jogging through the park by themselves? If you go with your significant other, you can't jog side by side. You have to be apart from each other. I mean, these are the questions. And then you get the question about what if we're a group of joggers or a group of bike riders, and then what about yoga? That's a form of exercise. Can we go in with a group of yoga folks? And I mentioned this because this is how we did it the first time. We opened up parks to exercise. Before you knew it, we're back to the old normal of everyone gathering uncontrolled. But to your point, Ryan, I do think there's a way to do it. And I think the first step is to solitary exercise and exercise only. And that could be jogging, it could be walking, it could be bike riding, but by yourself initially. And of course, still crossing the park to swim, surf, paddle, those kind of things. And then slowly open it up to more types of people, maybe multiple groups coming in. And at some point, allowing people to gather, but again, maybe limiting the gathering group to just 5 and requiring that people, if you're going to do a pop-up tent, to get a permit from the Department of Parks and Recreation, and you give the name, you know, Ryan Clay Suji is the permittee for this tent. And so if you have 10 or 15 people and HPD shows up and they ask for your permit and you show it to them and you have 10 or 15, they may cite you, right? Because you're responsible for your group of 5. I think that's the way you control gatherings in our parks. Until there's a vaccine, we're going to have to control that because we're social animals. I mean, we want to be together and we're human. We're not perfect. And before you know it, we'll be gathering in more than 5 or 10. And pretty soon we're not wearing our face coverings. And then we have another spike in the spread. And that could happen, by the way, if we're not careful just around the holidays. And wouldn't it be horrific if we had to shut down yet again? So we need to be a little more careful this time around, all the way through until there's a vaccine.
You know, you just mentioned a bunch of ways that you're sort of, it sounds like almost working around the Department of Health when it comes to contact tracing and the surge testing. Do you think the Department of Health has been a good partner to the city in combating the virus?
I think up until recently, there was no real partnership. It was more, we're doing fine. We don't need your help. Get out of the kitchen. And after repeated efforts to try to get in the kitchen to help. And so it was very frustrating, I have to say, particularly since we wanted to work together. I prefer someone who's, even if they think they're doing okay, would say, yeah, how can we help each other? Let's get better communication. Exactly what is it you want to do? And perhaps you can help us in this way. And that's where General Hara, just talking about contact tracing, you know, he has his National Guardsmen at the convention center. And when we were talking recently, he says, so you want to hire contact tracers? Can we coordinate what we're doing? I said, absolutely. We want to ask the same questions. We want to fill out the same form. We want to provide the information to the Department of Health in the same way. And then we want to do all of that. And at some point, perhaps our people become your people, or perhaps the people we're hiring work directly under you. We're open for all of that. But what I like is General Hara is at least saying, how is it going to work? And let's get it to work well. That's a partnership. And that wasn't occurring in the early days with Department of Health.
You know, Mayor, we only have a few minutes left, but we still have a lot of questions. So we're going to do what we call our fast kind questions, and we're going to put you under the test. So if you can sort of, these are really simple one-word answers or one-sentence answers, so we can get through as many as we can, because there's a lot of just general questions that people are asking. So we're going to try to get through as many as we can right now in the last 2 minutes. Are community gardens open during this time?
No, they're not.
Okay. How many people can fish off a boat together?
I don't know. I think, I mean, it's an interesting question. I think I'd say 5 or less. But this is something, you know, we don't have control of the waters. The state does. Is it okay if I get back to you on that one? I apologize.
Yeah, definitely. If somebody wants to volunteer to become a contact tracer, is that something you folks are looking for?
Yes, we're looking for help. Call 768-CITY and we'll get that person in contact with the right person at the city.
Another question we got in, are you allowed to ride bikes during sunset, like the Beaky bikes?
Yes, you can ride bikes on the roads around Oahu, and we'd encourage, that's a way to get exercise. And you can jog on the sidewalks, and in certain areas there's no sidewalks. You can do all of those things as the sun sets. You can even do it in the evening, but be careful because, you know, it's a little bit dangerous.
Are drive-through celebrations still allowed? We saw a lot of these during graduation season. Are those types of drive-through celebrations still allowed right now?
Right now, it's a stay-at-home, work-at-home situation where you only should be out for essential functions, and drive-through celebrations are not essential functions, as much as it breaks my heart to say that.
Okay. Well, and last one, maybe we get to, what type of proof is needed to show that you live in the same household as someone? If you're questioned, is a lease agreement doable?
I would say lease agreement, driver's license sometimes shows your address. It could be a board of water supply bill, any other kind of bill, you know, a cable bill, anything that shows that you live there. And, you know, I don't think they're going to get, you know, that into detail, but those are the documents you could show.
Okay. Well, thank
Any
you,
other
Mayor.
questions? One last
Well, we'd invite a closing statement from you. We know that you are right out of time. It's 11 o'clock, and we were told that you had to leave right at 11. So we just asked for a final thought from you as we head into the weekend. A lot of people so frustrated right now with having to do this again. But as we know, this is a matter of life and death right now.
You know, if I equate it to a war and we're on war footing, and I'm asking the folks of Oahu to dig deep, to make more sacrifice. I know it seems like a setback, but I know we can get through this together. We really can. 2 weeks, you can say it's not a long time, but every day can seem a long time. We have fatigue from COVID, but just like a war, just like World War II, there was a lot of fatigue, but we came together as a nation, as a state, and as a city to fight the enemy then. We can fight this enemy. Let's keep working together. Let's make sure we can bring this number of cases down, and then we can start to open up in a more thoughtful, protected way, all of us working together.
All right, Honolulu Mayor Kirk Caldwell, thank you so much for taking the time on this Friday to join us. We appreciate it, and we hope to catch up with you maybe again in a few weeks. Aloha.
Okay, thank you.
Thank you so much. Well, Ryan, very interesting to hear from him there. And he was very candid in his, criticism of the Department of Health, basically saying that they were not partners in the way that he had expected or would have liked. But hopefully they've turned a corner and that is changing now. We see a lot of you guys writing in. We got to as many questions as we could. The mayor, obviously a very busy man, and we do appreciate him spending a full half hour with us. And there will be a lot more testing sites available. He mentioned Aloha Stadium and H3. Ryan, we've never seen anything like that before.
Yeah, and some people are asking, do I need to get a test to drive on the H3? No, that is not what that thing is happening. It's basically they are shutting down the H3 for this time and this day to allow for this testing to happen. So those who regularly utilize H3 on there, they should obviously use alternate routes like the Pale or Like to get around. But that is going to be interesting, Yanji, because once you commit to taking that test on the H3, as you know, on the H3, there's not a turnaround point. So once you are in line, you're sort of stuck in there until you kind of get the test. But we'll see how all of that pans out. And again, him crediting Dr. Burks, who he revealed that he had the conversation with her, was a former Hawaii resident, which I didn't know, but said that she called the mayor and said she understands the unique demographics of the city and county of Honolulu, and really allowed this sort of this surge testing to become available along with the help of the Surgeon General.
And also the mayor mentioning that he himself is personally calling businesses that may be violators. He said that right at the top. He had been on the phone this morning with some furniture stores that are not supposed to be open and that were in fact open. So that's certainly not a call as a business owner you want to get from the mayor. And he did say that if you see a business or perhaps a party or something that you don't think should be happening with the stay, work at home order, you can call the city's hotline. They are getting hotline calls and they can go investigate. Obviously, that's not something that you should police yourself. The other thing is that they are using community health centers and some of the smaller sites in addition to those mass testing sites. So if you can, please go to COVID19test.com. Ryan's put up the website there. You fill out a simple questionnaire and it will tell you where to go based on your zip code, and you can get that test hopefully sooner than later. That's registration you don't have to do on site, and you can just go ahead and get that. And he did mention, the goal of 5,000 tests a day. Much larger cities have not reached that. So that is something that they're trying to stand up so we really get a handle on the virus.
And they are, again, anticipating with those the amount of testing that is happening. He's saying that they almost reached that 5,000 mark on their first day, that those test numbers and those positive results that we see in these daily reports are likely to go up because of the amount of tests that they are really conducting. And so there is some discussion happening right now if we should be taking on that many tests, that the numbers will definitely reflect a higher count. But the mayor is saying that they need to know where this disease is, what areas of the community that they need to spend more time focusing on. And he also did mention that they're going to be focusing on some of the public housing efforts and areas of the community in order to allow some stand-up testing there as well. Also talking about those workouts and being able to work out in the parks and the beaches potentially, but having to do it solo. And we'll see how that happens and if that sort of rolls out over the next few weeks.
Yeah, so we are with you now 3 days a week, starting this week and next weekend for all of September. On Monday, the governor is going to be joining us, and he has generously committed his time. He's going to be spending every Monday with us, which will be great because we know things change so rapidly, and he can give us a great handle on the state's efforts, whether it's testing, the economy, all of the things that they're doing as they battle the pandemic. So Governor Ige will be joining us on Monday. With the shutdown, of course, we do unfortunately expect more people to be out of work. So the person who is standing in for Scott Murakami at the Department of Labor and Industrial Relations, Murakami obviously left earlier this year. Anne Pereira Estaquio will be joining us on Wednesday to answer all of the unemployment questions. So if you are navigating this system for the first time, or you are frustrated and haven't received benefits, we know there are still people who are very frustrated by the system. Join us on Wednesday because we're going to be getting into the weeds with the unemployment system with her.
That's right. And then we'll close out the week next week with Cor Rosenlee from the HSTA, who's going to talk a little bit about the challenges teachers are facing. We do know, of course, the announcement coming through yesterday that the Department of Education has extended the virtual or distance learning all the way through this first quarter. There was some discussion about why teachers and why those announcements weren't made earlier on, where teachers were having to go into classrooms and continue this. But they did come out with that official announcement yesterday saying that the first quarter will continue to be virtual learning. So we'll hear more about what teachers are going through during this time by Corey on Friday. So a lot to look forward to, and we hope to continue to bring you as much content as we can here on this platform.
Until then, we wish you a very safe weekend. Remember that order is being taken very seriously. The fines are serious, and the consequences for violating, not only, of course, with law enforcement, but also from a public health standpoint. The mayor talking about seeing those patients at Queens. 3 more deaths, he said today, more than 200 cases. So this is very real. As he said, we are on a war footing. Wear your mask, only venture out when absolutely essential, and stay safe out there.
We'll see you next week, Monday, here at 10:30. Aloha.